Now we have no injections at all. We just have tablets and you have to take it at home, and it's a very simple treatment. So when a person gets infected with mycobacterial tuberculosis, that is a bacteria, it can enter from any part of the body. So it can enter from the nose, it can enter from the mouth, it can enter into other skin areas also. And it can infect practically any organ of the body. So tuberculosis is one of the disease where practically right from head to toe, any part of the body can get infected with this bacteria. This is something which spreads through the droplet route. So when a person who is infected with tuberculosis coughs, what happens is all those bacteria are released in the atmosphere. And another person who comes in contact with that kind of droplet and inhales those droplets, what will happen is all will go inside his or her respiratory system and will start developing that particular disease. So this is again a droplet infection. Most common route is the respiratory tract, and the person does end up getting a pulmonary tuberculosis, which is basically a tuberculosis of the lungs. So when I talk about the symptoms, the most important organ which is getting affected is the lungs. So let's restrict ourselves to the lung symptoms. So typically when a patient gets infected with tuberculosis, what will happen is he'll be coughing. There will be cough which is persistent for 2 weeks and 3 weeks. Other thing that will happen is fever. It would not be very high grade. The fever generally in tuberculosis is low grade, 99-100 degrees, which is persisting for a long period of time. That is very common. Third thing which is very important is the patient will start losing his appetite. The weight will start reducing. There are significant 3 kilos, 5 kilos weight loss over a period of 3 to 4 weeks. The treatment is very straightforward. We have very good drugs which are available with us. Generally, the course for the drug-sensitive tuberculosis is 6 months, but depending on where the tuberculosis infection is, and depending on multiple other factors which a physician would decide upon, the treatment can get extended to 12 months also. But most likely, your treatment would be for 6 months only. Two most important drugs, that is bedaquiline and delamanid, are now available in India, and they are very good drugs for tuberculosis infection. And even in drug-resistant tuberculosis, they work really well. And the treatment, if taken properly, you have very good cure rates. And the treatment is not very tedious as against to the earlier times where you used to take injections every single day. Now we have no injections at all. We just have tablets and you have to take it at home, and it's a very simple treatment. It's a communicable disease. You need to take proper care that you don't spread that bacilli or the bacteria to people around you. Again, the same techniques which are very important is first is always cover your mouth when you're coughing or sneezing. That is most important thing. Whenever you're going out in public, please wear a mask so that you prevent other people. And this is also for healthy individuals also. It's always a good idea when you are in a crowded area to wear a mask so that you are prevented from developing such kind of infections. So yes, it's a communicable disease, but if taken proper treatment, you have wonderful response rates, and at the same time you would avoid spreading it to your close members also. So not many of you would be knowing that we have a vaccine for TB. Actually, every one of us has taken it. In childhood, in the immunization schedule, everyone at birth receives a vaccine called as BCG, which is nothing but the TB vaccine. You might ask that, I have taken a TB vaccine, why did I get infected with TB? The idea is this vaccine is only given for the sole reason that it prevents severe form of tuberculosis, and predominantly brain tuberculosis. So it doesn't, prevent you from getting infected, but it prevents you from developing a severe form of tuberculosis infection. Similarly, as against to a COVID vaccine which we have seen. It doesn't prevent you from getting a COVID infection. It just prevents you from getting a very severe form of COVID infection.
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.